everybody. Recording live from somewhere. This is Zach Cupples with episode number 135 of the Movement Debrief. And today, folks, you are about to know squat. Because we're going to talk about squatting, deadlifting. We're going to fine-tune some wild and crazy questions in regards to both of these lifts. If you're butt winking for days, if you use mixed grip deadlifts and you're wondering, what's that going to do to me? If you're doing all other types of crazy things on the squat and the hinge, this is the debrief for you. Because your boy, Big Z, has got a bunch of questions that have been asked by the people. They will be answered for the people by this people right here. Fam recognized fam. Without further ado, let's debrief, shall we? The first question comes from Alan. And here's what Alan asks. Quick question about squatting. I know the stack is important, but what are your thoughts on buttwink, especially when loaded? I'm not sure if I'm getting a good view here, but it looks like some lower lumbar flexion at the bottom. I know Stuart McGill is big time against this and has his research with loaded posterior pelvic tilts, which caused a lot of pain. So I just wanted some clarification or some perspective, if you have time. The dreaded butt wink. Not the cool kind of wink like you got in your emojis, which I wonder what a butt wink emoji would look like. Anyways, so for those of you who don't know what a butt wink is, a butt wink is basically when you're doing a squat, all is good, and you can't attain any further depth. So then there's this aggressive appearance of a posterior pelvic tilt on the way down. What I think this does is it allows someone who's moving in a posterior direction, so if your squat is a bit more hingy, it allows you to attain depth by doing this dramatic and aggressive posterior tilt or orientation of the lower body so you can go straight down. Usually, the butt wink is most commonly seen on a back squat, and I think there's a reason for that. With a back squat, because the bar is on your back, that's going to shove the thorax forward. When the thorax is shoved forward, there's a reduction of the normal kyphosis that we should see in the thoracic spine. The thorax, the thoracic spine, and the sacrum are mirrored in terms of their directionality. There's a lumbar lordosis, there's a cervical lordosis, there's a thoracic kyphosis, and there's a sacral kyphosis. If I have a reduction of the thoracic kyphosis, I'm going to also have a concomitant reduction of the sacral kyphosis, which what that means practically is the sacrum is nutated, or it's tipped a bit more forward. That's likely the reason why a back squat is a bit more on the hinge spectrum than, say, a front squat, which has a lot more verticality within the ventral cavity as you go up and down in the squat. When you do a back squat, you go down, you're nutating for days, and then likely to attain that depth, it likely isn't counter-nutation of the sacrum, which would be the sacrum tipping back, because the pelvis is at a disadvantaged position to do that, especially when I'm so posteriorly displaced, like in a back squat. The greater posterior displacement of the pelvis you have, the more nutation is present. But you still got to get down. Shorty still got to get low if you want to move big weights to and fro. So what likely happens instead is there is an increase in lumbar flexion to bring the pelvis back forward so you can get it underneath you. And that's what allows you to drop down in the squat. And that, folks, is a butt wink. From a research perspective, that's likely what is going on. If you look at this study, which I'll link in the show notes, which will be found on zachcouples.com/squat-deadlift-details. Really got to find shorter permalinks, but squat-deadlift-details. And also, if you haven't been checking them out, please check out the show notes because I also write corresponding blogs with this, so you can get 3 swoops with your boy, Big Z, possibly 4. You watch the IG version, you watch this super edited, sexy version of me video. And then I enhance the audio so the podcast sounds good. And then you can read it. Man, your learning will be on point. So definitely check out the show notes. But the study, I believe, is called the Lumbar and Sacrum Mechanics, noticed during the back squat. They took trained subjects. They defined train as a year of training. And they put a barbell on their back, and then they put a barbell with 50% of their body weight on their back. Guess what happened, folks? As soon as that occurred, the lumbar spine became kyphotic. That's lumbar flexion. Oh no. These researchers then argued that going the other way, arching your back to preserve something, is likely maladaptive and counterproductive when we're talking about squat mechanics. With that in mind, and with what we see on the back squat, and giving the mechanics that I outlined of the back squat, chances are some degree of butt wink is normal during something like a back squat. We should see less of it during other squat variations, especially front-loaded ones, because when you're front-loaded, it's a lot easier to get sacral counternutation. And the reason why that is when you load in the front, it's easier to expand the back and increase thoracic kyphosis, the normal amount. So if I have increased thoracic kyphosis, I should be able to have increased sacral counternutation and allow me to have better verticality on a squat. So butt wink is likely to some degree, and I don't have an exact degree, it's likely different for you and I, on a back squat. Now, the question then, and this is what Alan said later on, well, Stu McGill says that flexion is likely problematic. If you do posterior tilts, there's pain involved. I talked about this in an earlier debrief, is spinal flexion bad? And I looked at the body of research. Most of McGill's stuff, or if you read some of the stuff on discal pressures and so on, a lot of that is in vitro, meaning they're using models. They're either using pig models or they're using isolated vertebral segments with Harrington rods, so there's only sagittal plane motion occurring. And then they're doing repeated flexions to failure, and then problems ensue. If you look at the body of literature on in vivo experiments, meaning measuring us IRL in real life, there doesn't seem to be any research at this point supporting that loaded flexion is a bad thing. It doesn't seem to be increasing injury risk, among other things. The only downside about that literature is most of the loads that they're looking at when they're doing this research are not heavy. It's 50 pounds or less, because that's generally what, if you look at the worker world, that's usually what they limit people to lifting in most jobs, is 50 pounds or less to preserve back health and minimize lawsuits and workers' comp injuries. Unfortunately, most people don't really care so much about the health of people who want to back squat heavy weights. Okay, we don't have in vivo stuff to know if our spines are safe with heavy loads in a flexed posture. Does that mean we default to the in vitro experiments that McGill is alluding to? Well, it turns out that even that body of research has been called into question. I recently finished this great book called The Spinal Engine, which takes a completely different look at a lot of the in vitro research, and I would strongly encourage you to read it. It's pretty fascinating, and they also, the way that this book looks at gait is quite interesting as well. But they actually, this guy does a comprehensive review of a lot of the in vitro experiments done on the lower back. Interestingly enough, if we're talking about lifting very heavy weights, and if you bias the spine into more extension or you increase the lordosis, that's going to definitely target multifidus and the erector spinae a lot more to enhance the lifting of the load. But here's the problem. The amount of force that these muscles can produce in isolation is not that much. And in fact, to look at heavy loads, like when you're lifting big weights on a back squat, it's typically not enough force to be able to produce in order to enhance the loads effectively, or to lift the weights effectively. In order to move heavy-ass weights, you need to be able to recruit contractile properties of the fascia and the posterior ligamentous structure. And again, according to the spinal engine, if we can believe what's in there, they argue that the only way that that can be done is if there's some degree of lumbar flexion occurring. And guess how they advocate lumbar flexion occurring? A posterior pelvic tilt, aka the stack, aka talk to Zach, fam. What that does is it creates a bit of tension in the posterior ligamentous structures and the thoracolumbar fascia, so you can use those tissues to allow you to move heavier weights. Another interesting thing that they argue in this book is that compression alone is insufficient for discal injuries and injuries of other tissues. It seems as though there has to be a substantial degree of not just compression but also torsion among other stressors to the lower back in order to introduce injuries into the tissues. You're probably not getting that much torsion effect on a back squat. Is it safe to load with a flexed lumbar spine? It's still probably up in the air, but we don't have any research to show that it's unsafe. What I would advocate for is, if the goal with a squat, as we're defining a squat, and how do we differentiate a squat from a deadlift, is to have more vertical displacement of the pelvis going up and down than horizontal displacement. You need to have some semblance of tucking to have that happen, and likely tucking is going to allow you to better recruit the posterior ligamentous structures as well as the thoracolumbar fascia to create enough stiffening in the spine to be able to move weights heavier than you normally would. Where I think I've erred in the past is specifically on how we're coaching the tuck. I've been emphasizing doing this type of tuck a lot more recently, and it's led to profound success, because the issue that I ran into is, your boy, he teaches a bunch of heavy lifting bros about stacking and things like that, and they're like, cool, I'm going to keep the same weights that I had before, and I'm going to stack as I do my back squat. And guess what happened? Lots of them had back pain. So then they're thinking, oh, well, I'm just going to do hingy squats till death do us part. Not that squatty squat BS. False. I'm sorry. I probably led you astray. What likely they were doing, instead of what I want with the tuck, which is counter-nutation of the sacrum, is they were not changing the pelvic dynamics whatsoever, and they were just flexing the lumbar spine to a high enough degree that the pelvis moved forward in relation to the thorax. So they couldn't keep the thoracic and pelvic diaphragms atop one another, and because their tissues were likely not adapted to load axially in that fashion, back pain ensued. Now, that might be okay if they had dropped the weights a little bit and slowly exposed themselves to squatting with a new technique. But I also think, too, where we erred was not really coaching the counter-nutation of the sacrum. And the big cue that I've been incorporating lately to make that happen is to think about pulling your tailbone to the ground or the back pocket tuck. Or think about just making your pelvis long. All three of those cues have really changed the responses that we're getting, not just with loaded exercise, but also some of the lower level reset activities that we use to improve movement. I think if we can emphasize that during squatting as opposed to this aggressive lumbar flexion, I think we'll get better vertical displacement. We'll be better able to maintain the stacked position when we're doing exercises like this. And it should allow you to have better vertical squats and get more out of your moves. And I think that that's probably a much more appropriate way to advocate for getting some semblance of the tuck during squat-based activities. Also realizing that the degree that you'll be able to do that on a back squat is going to be less compared to anything anteriorly loaded. To summarize your great question, Alan, butt wink, likely happens with aggressive lumbar flexion to allow for vertical displacement of the pelvis to occur, most notably during the back squat. Research is pretty sparse to say if flexion loaded is bad. In vivo, that's measuring life. In vitro, it's actually a crapshoot if you read the spinal engine and you compare that to what the research McGill is talking about. So I don't think we can safely say one way or another if flexion is bad. However, I think with squatting, our goal should be to have vertical displacement of the pelvis. The way that we can do that is by cueing counter-nutation of the sacrum. That should maintain a stacked position as you're doing the squat, and it should allow for you to better recruit thoracolumbar fascia and the posterior ligamentous structures to be able to have better force production at the axial skeleton so you can move heavy ass weights. Alan, awesome question. Javier with a follow-up on this one. Does the increased buttwink mean we are losing relative motions between the sacrum and the iliums? Yes, I would say that's likely the case because, again, if I'm starting in a nutated position and I'm posteriorly displacing the pelvis, this is a really disadvantaged position for me to do counter-nutation because you would be, as the technical term would be, nutated AF in that spot. So if you can't counter-nutate here, your only option to get depth then is to flex through the spine. And that would be indicating a loss of relative motion at the SI joint. Cueing tip I use from Coach Transformer, belt buckle towards the navel. Yes, I like that one as well. Basically anything that makes the change more up and down as opposed to swinging the pelvis forward and backward is a big win. So I love that. I use that as well. The next question comes from Matt. And here's what Matt asks. If someone is clearly a better hinger than a squatter, and they only have 5 degrees of hip internal rotation, yikes, and also limited in hip external rotation, which would you attack first? I know you said you go after primary compensations first. Interventions can be less successful if they're secondary compensations. So I want to make sure I get this right from the start. These are tough ones. I'll tell you what, like one of the toughest populations that I have is people who have super stiff hips. First thing I would say is if you're doing interventions and you're not getting any change, I think it's really important for this population to get some imaging because if it's an older population, you might be looking at osteoarthritis. If it's a younger population, you could be looking at cam, pincer impingements that are structurally bad enough that they may actually be surgical cases in order to attain depth. I don't, unfortunately, the research on efficacy of the surgeries to improve impingement is sparse, but if you have a structural issue, you need to do something about that. I have this one guy who I spent some time working with. He's a golfer, and when I bring him into flexion and I test IR, he doesn't have hardly any IR, but he gets to about 90 degrees and he can't go any further. He gets pinching of his hip unless he does this and then he abducts and it's like he circles around and then he can get back to straight plane flexion. It's the weirdest thing I've ever seen. There ain't a thing you boy can do about that. That is like a structural issue and likely is going to need surgery in order to fix that. So just be mindful of that sometimes if you get someone who is super stiff, there could be a structural thing at play. With that said, let's talk about what is the order of priority with someone who is essentially A to P compressed in the pelvis because they have restrictions both in ER and IR measures. You have to look first at the infrasternal angle presentation because the secondary compensation, as Matt discussed, is what we need to tackle first more often than not. And the secondary compensation is going to be different depending on your structural archetype. If I'm a narrow infrasternal angle, you want to go after ER-based measures first because that is a secondary compensation. I'll link a debrief in the show notes that outlines that. If you're a wide, you want to go after IR-based measures first, because that is the secondary compensation for a wide ISA. Things that would attack either of those. Let's start with the narrow first. So what does this look like to build the squat for a narrow? So a narrow is going to need to do things to improve ER, which would be things that would involve any type of posterior expansion first. That's your first starting point. So things like drunken turtle, squat progressions, things that are going to drive counter-nutation of the sacrum, high depth activities where you're driving tucking, all of that can be quite effective. Also, too, anything that's going to get posterior thorax expansion is going to be effective as well. So low reaches, inversions, stuff like that, great for a narrow ISA. Because a squat is not just the sacrum counter-nutating. It is the entire spine going into an inhaled orientation, aka your entire back needs to be eccentric as all hell for you to be vertical. For a wide, you want to go after anterior expansion first if they have this limitation. But Zach, you just said to be able to squat, you need posterior expansion first and foremost in order to make that happen. What the hell are you talking about now? You do. However, when I go through hip flexion from about, depending on who you are, 45 to 60 degrees of hip flexion at the starting point to 90 to 100, there's more of an internal rotation bias happening at the femurs. And that's going to mean that the pelvis will be nutating to some degree. Not nutation, that doesn't mean that they're going anterior pelvic tilt is all hell. It just means that I started in a counter-nutated position and then I'm moving towards nutation at that point. And then if you can squat ATG, you're going to re-counter-nutate at the bottom. Therefore, you're going to need some semblance of internal rotation to squat. 1. 2. Restoring internal rotation and anterior expansion is going to allow you to have a gradient to move the viscera, the synovial fluid, and airflow within the body to allow you to get posterior expansion. Because there is an A to P compression going on for this particular individual with a slight bias and more expansion posteriorly in this case, and the reason why that is because a secondary compensation uses more superficial musculature than a primary compensation. You have to be able to shift stuff forward first so you have a gradient, meaning you have a place of high concentration of stuff to low concentration of stuff that you can then remove in order to attain depth. So by expanding anteriorly, you push all of the stuff, air, viscera, synovial fluid forward, and you expand as far as you can. So then you have more stuff that you can push posteriorly to allow that person to squat effectively. Again, check out that debrief that I'll link to dive a bit more detail into that. Things to drive anterior expansion would be mid-range depth squats, hip extension activities, anything that drives the pump handle. Things of that nature are really good at getting anterior expansion and restoring internal rotation. Many times I've found for this population in particular, you may actually have to do some manual stretching to get hip internal rotation. I have my bag of tricks for that, but if you're a manual therapist, I'm sure you have some good stuff to get hip internal rotation. I don't think it matters that much. Just pick something that works. Once you have those things in place, then you can start working on squat progressions to try and attain depth. Truisms that I think are effective for both narrow and wide is doing things that would involve A to P expansion simultaneously of the pelvis. There's two good ways you can do that. One would be the short lever side plank, actually. Interestingly enough, if you are doing a short lever side plank the way I like it, which is rotating up and forward, what's going to happen is when you're up in this position, gravity is going to be pushing the viscera in the pelvis, the goods, downward. meaning it's going to create A to P expansion in the bottom part of the pelvis. Guess what, folks? It's actually a good way to get A to P expansion to some degree in the thorax as well, because gravity is going to push air further down. So that's a really nice way to get some A to P expansion in the pelvis. Any type of side lying move could be money for that. The other thing you could do, once you've done all the other stuff, I cannot stress that enough, is to work on hip shifting. I like high depth hip shifting. I like just a side lying hip shift, anything like that. Because when you do a hip shift, assuming you have the stack, and that's why I say you got to do that stuff first. But when you do hip shifting, you're creating some degree of sacral rotation. When I have sacral rotation, I have to have expansion on one part of the pelvis and compression on the opposite side, and then vice versa. So when I rotate the sacrum to the left, I have to have posterior expansion of the pelvis on the left side and anterior expansion on the right side. It's the same thing for the thorax. So if you're trying to really attain good squat depth, A to P expansion and rotation of the pelvis are very useful for making that happen. Last but not least, I think this is good for both of these populations, is make sure when you are squatting, you are using a ramp. There's a ramp that I like. It's made by my guy Levi Kirkpatrick. It's awesome. I try to push everyone to him. I don't get any money for it either, just a heads up, folks. It's a really good ramp, and Levi's a friend. So take that for what it's worth. But his ramps are stellar, especially if you do the higher incline one. Almost everyone at Elevate where I work, they are squatting on that ramp. And it's a great way to minimize any potential ankle restrictions. And also, too, if you look at the research on heel elevation with a squat, it allows for better pelvic verticality, which I think is essential. And if you can get a vertical pelvis, that's going to allow you to go through both the ER and IR phases of hip flexion, which is needed for a squat. And if you do that, chances are you're going to be able to get improvements in hip range of motion with these people, and your supreme clientele are going to be squatting super duper on point. Awesome question, Matt. Folks, if you are wondering, well, this sounds all well and good, but the way you've been coaching a squat, I don't have that much experience doing that. Or perhaps you're thinking like, well, I don't even know how to know if I have primary or secondary compensations, and I want to know how in the hell can I measure that? There's a way you can measure that, and there's a way you can learn how to measure that, and the answer, folks, is Human Matrix, my seminar. And the reason why I'm announcing it is, unfortunately, I'm postponing all of them to 2020, but let's hope, folks, that the world heals in 2021, and I want you to keep your eyes peeled because I got a bunch rescheduled for next year. I just want to throw the dates your way. The dates are the first one, February 20th and 21st in Atlanta, Georgia, where the players play. April 10th and 11th, Warren, Ohio. May 29th and 30th, Boston, Massachusetts. August 14th and 15th, Ann Arbor, Michigan. September 25th, 26th, Wyckoff, New Jersey, outside of NYC. And November 6th and 7th, Charlotte, North Carolina. Those are all 2021. I'm still working on rescheduling a couple. Stay tuned. Depending on where we're at, COVID-wise, I will do all in my power to try to make it as safe as possible for us to attend. So please give that a shot, and hopefully the world heals. The last question comes from Matt again, round 2, fight. Here's what Matt asks. Would lots of exposure to heavy, he all caps it, that's why I said that, to heavy mixed grip deadlifts influence the infrasternal angle over time? I have a few clients with asymmetrical ISAs who are strong, 200 plus kilogram deadlifts. Damn, that is strong. And they all historically have opted for right hand supinated, left hand pronated, especially for near maxes. I guess it could be a chicken egg situation where they opt for that strategy based on structural constraints, or is the structure reinforced by that strategy? I'll just preface this. What we don't know. We don't know if doing things asymmetrically are going to predispose you to having asymmetrical infrasternal angles. because we don't have any research, and I haven't taken someone who has a relatively symmetrical infrasternal angle and then had them do something a certain way and then retest it over a period of time. So I don't think we can say with confidence if that's the case. But interestingly enough, you mentioned that, and he dove in a little bit deeper. He said they were narrower on the left, wider on the right. Let me preface: you can't be narrow on one side and wide on the other. And he mentioned a specific type of grip: right hand supinated, left hand pronated. I think that actually those two things are intimately linked. When you see someone who has a asymmetrical ISA with a narrower on the left side and wider on the right side, chances are what you're dealing with is a rotational action through the spine. In the lumbar and thoracic spine, both of those areas exhibit type 1 mechanics when we're discussing Fryet's laws. Now, these laws have come into question because a lot of it depends on the degree of flexion extension that's occurring in the spine, as well as the position of instantaneous center of rotation. So what is the rotational point that I am looking at when it comes to me moving the spine? But basically what the type 1 mechanics are is when I side bend, in this case to the left, and I rotate oppositely to the right, that would be a type 1 Fryet mechanic. So side bend and rotation are opposites, and they're a coupled mechanic. In this case, if I have a narrowing on the left ISA and the right appears wider, that is because the spine is side bent to the left. And then guess what, folks? It's going to be rotated to the right. Now, interestingly enough, what would I do with my arms to induce a rotation to the right? Oh, wait a minute. Matt said that a right hand supinated and a left hand pronated are what type of deadlift grip these are using. Well, guess what, folks? That arm position is right rotation of the spine, because when I ER my right arm, that's going to increase posterior expansion on the right, meaning the spinous processes are going to move to the left. When I pronate the left arm, that's going to increase anterior expansion, meaning there's going to be more posterior compression, which, guess what, folks, is right rotation of the spine. So it does not surprise me that these two things are linked. However, Matt, I will echo when you said, is it a chicken or egg thing? I don't think we can say if the structure has dictated that they do better with this, or if they do this and that caused the structure to adapt. Because the other thing we have to take into consideration too is the asymmetry in the ISA that you have alluded to is also to some degree normal because of the viscera. And there's a lot of other factors that go into a general rightward bias within us. So my thought is there's a lot of convoluted reasons as to why this could be linked. But they are linked, because when you do rightward rotation, you're going to get a concomitant side bend in the spine, and that can make the ISA appear to be asymmetrical, although it is not. The infrasternal angle, the narrowness and the wideness of the ISA are the structural components that you're seeing, because this is just the way we're built. Again, I would check out the torso integration hypothesis by Torres Tamayo, because they talk a lot more in detail about those structural differences between us. Now, interestingly enough, you could look at some testing for these peeps to see if they needed to do things to involve leftward rotation, because if you switch your grip, you pronate on the right, you supinate on the left, that's going to induce some rotation to the left. And that may actually side bend them to the right, which, if they don't have dynamic capabilities in their ISA, that could totally be a potential move you could give these folks. Things that would point you that they needed that would be the asymmetrical ISA, 1. 2, if they have anything that would indicate a loss of rotation to the left. That could be seated rotation. It could be cervical rotation. It could be a loss of ER on the left, flexion on the left, loss of IR on the right. Those would all be things you might see that would implicate this person needs rotation to the left. You could use the heavy deadlift to try and improve that, and you may need to do some tougher exercises to induce the changes in movement options with these strong people. But you could also do things that just involve single arm work. Anything that would drive rotation to the left could potentially influence this. To summarize your amazing question, Matt, asymmetrical ISA is, especially if it's narrow left, wide right, most common, is a side bend and rotation, side bend ipsilateral, rotation contralateral, which is type 1 Friet mechanics. That can be influenced by asymmetrical ISAs, or at least feeds into that. You would have to have a right supinated, left pronated grip to do that. If you did the opposite, you would rotate the opposite way. So these folks who you're talking about may need to drive more leftward rotation in order to improve their movement options and keep deadlifting like a bunch of bosses. Awesome question, Matt. I think, folks, that's a good stopping point for us today. I want to thank all of you beautiful, sexy, outstanding people for tuning in to 135 of the Movement Debrief. And I want to know, don't leave just yet, because I got a bunch of stuff that I can help you with even further if you want to progress your learning even more so. The first place, folks, is to go to zachcupples.com. And while you're there, subscribe to my newsletter, because what you will get is a ton of free stuff. You'll get access to my free seminar, Human Matrix Foundations, which will give you a lot of the didactic material to better understand things in the debrief. You'll also get access to the Common Compensations Workbook. What that does is it simplifies your coaching so much, because we see people doing a ton of wild and crazy compensations when they're moving and grooving. And you're like, what are they doing? I have no idea. Well, what if I gave you 2 options to determine what they're doing? That's what the Common Compensations Workbook does, is it breaks things down into 2 potential options that your supreme clientele may be exhibiting when they're doing some type of loaded activity or any movement in general. So check that out. You'll also get 5 hours of free talks, free acute to chronic workload calculator, goodies from your boy every Friday. Give it a shot. Also, on my website, I offer a lot of services. If your squat is whack and you want help from Zach to squat lower, we can do a movement consultation. What that entails is I perform a full movement evaluation on you. I take you through movements to improve your movement capabilities, and a lot of times we can get people squatting less asymmetrical and deeper by doing that. You can also kick it up a notch. You're like, Zach, my squat feels great. And now I want to take that squat and improve my fitness levels while respecting my movement restrictions. Well, folks, that's where online training comes into play, because I can take that movement consultation information and write you a 6-week program and beyond. You'll get coaching from me through TrueCoach. So you can send videos to me, show me what you're doing. I'll give you some feedback, and we can help progress your fitness goals better than ever before. It's really tough to be objective with yourself training-wise. I can be that relatively objective person to give you the stuff you need to be successful. I currently have 3 slots open right now, so please sign up, because they might not be there long. If you want to learn how to do this stuff with your supreme clientele, you're like, man, I got people who have these weird-looking rib cages, and I want to know how to get them moving and grooving better, or maybe they're hurting and their squats don't feel good, they can't tolerate loaded flexion, I need help, I can be your help. That's where my mentorship program comes into play. There, we'll go through some of didactic limitations that you may have, troubleshoot through some case studies, and then I will give you some homework. I will check to see how well your coaching is with your clients, how well your education is with your clients, all the things that you need to be successful with this material and beyond. So check out the mentorship program. Once you've scoured zachcupples.com, you read a few blogs, you're like, man, I want more. Well, the more is Apple Podcasts and Stitcher if you search The Zach Cupples Show. Because guess what, folks? There's 134 other debriefs out there. And, we didn't have 2 camera angles. We didn't have good audio for all of them. Well, great. That definitely doesn't sell me on the podcast. But, You might want to listen to me if you've already watched this live because it can be another way to reinforce the material. While you're there, please leave a review so the fam can keep growing. I'm also on the social medias. Facebook and Twitter, search Z Cupples. Of course, I'm on the Instagram, baby. Zach, Z-A-C, Cupples, C-U-P-P-L-E-S. And last but not least, find your boy on YouTube. Search Zach Cupples. If you find me there, you'll get access to my exercise library, which grows almost every day, it feels like. I put indications for many of the more recent moves so you know when to use what for your people. Mess with it, see if it makes you move better, or see if it increases your gains like none other. Thank you so much for tuning in. You've been a beautiful, sexy, outstanding audience. And I hope that you keep it real, but not to the extent where things go wrong. Stay hungry, stay learning, stay moving. And I'll see you next time. Deuces.